Good morning and welcome to the American Heart Association BLS 2020 class. I have one student with me this morning, nurse practitioner, Dr. Strong. I'll be teaching her the BLS class. With further ado, my name is David Pfizer, Dr. Strong. I've been teaching BLS for over 20 some years. This is something I love doing. I feel like it's truly important. And the video itself is going to actually also show you why it's so important. Do you have any questions?
No, sir.
Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity.
Okay, they just explained to you what's going to happen on the video and some things that you may see that you may know is not kosher or we normally don't do without PPE. And they're going to be doing it, but and also with the male, they're going to be using male only. We're going to do the pre-hospital provider because that's the one that they require here for Shelby County Schools as well.
On any given day and at any time, you could encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you received today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There's more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the 2 adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. The 2 chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions. For the in-hospital chain, the difference is the 1st link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate.
Now, let's review the links in the out-of-hospital chain of survival as they could happen in a real-life resuscitation event. It's a normal day at the airport. A woman notices that her husband is not looking well. When he collapses, she immediately calls for help, and a security guard rushes over. The guard gets no response and sees no sign of breathing, so he directs a coworker to activate the emergency response system. The out-of-hospital chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must recognize that someone is in cardiac arrest. This person will have signs such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives.
Some rescuers might find it necessary to provide compression-only CPR until a barrier device is available. The guard begins chest compressions without delay. A second guard returns with an AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
As the emergency medical services, or EMS providers, arrive and take over care, they provide advanced life support, extending the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment.
Once the return of spontaneous circulation, or ROSC, is achieved, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
Now, we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So, we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there is still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast. There is some evidence that compressing too deep can increase injuries from CPR. However, a larger problem is that most providers don't compress deep enough. So focus on making sure your compressions are deep enough. Compress at a rate between 100 to 120 per minute while counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and you will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
Okay, so what we're gonna be doing, did you hear what they said about Ross? That was kind of new. Ross,
Yes.
the return of spontaneous circulation. Need to know that. That Ross that's after we brought the person, when they responded to our CPR attempt, they achieved Ross, and they still have to be monitored after that. And remember also, what we're gonna be doing right now, just as a practice, we're gonna be assessing the scene, and then we're gonna be starting with CPR. But the CPR, we're gonna go along with the video in a minute. But for right now, I need you to just stand back from your man, and then I want you to come up. When you assess the scene, just do like this. You don't really have to say it. You're gonna assess the scene, and then you're gonna check for what?
Airway.
No, what's the first one you check for?
I checked the front.
Responsiveness.
Oh.
You hit them. You slap
are
the
you
chest.
okay?
Are you okay? Right. And then after you do that, then what you do?
I
Okay.
assess the chest for breathing.
Okay, before that.
Are you okay? Are you okay?
And then remember, he's not okay.
Okay.
So when he's not okay, that means he needs some, what? Help.
Yes, and so.
He needs help, so call for help.
Call for help.
And then when the person comes, you're gonna tell them what?
Call 911.
And get
And
the
get the AED.
get the AED. Okay, let's do that little step right now, and then we'll move on to the chest compression. All right, step back. On 3, 1, 2, 3, go. Okay,
I
good.
assess the scene.
Okay.
The patient is unresponsive.
How you know?
Are you okay? Are you okay? And they don't
Okay.
respond. So
Voice only. You just use voice only. Back up one more time. What do you want to? How do you check for responsiveness? Remember, it takes a physical checking for responsiveness.
Right.
So
So
you get, yeah, yeah. All right, so let's start once again. We're gonna check scene, check for responsiveness, call for help, all those steps together.
okay.
All right, 1, 2, 3, man down, go.
I assess the scene.
Okay,
Are you okay? Are you okay?
He's not okay.
I assess unresponsiveness. Quick. Call 911. Go get the AED.
Okay? And then now, as a healthcare provider, what are you supposed to be doing? Because you're a healthcare provider, you know how to do these things.
Okay. So I check to see, first and foremost, I would check the carotid.
Yep.
And after I check the carotid pulse,
Just actually do it.
Okay.
And they say you do two things at one time when you're taking the carotid.
while I'm checking the carotid, I'm assessing for breathing,
Right.
to see the chest rise and fall. I see no rise and fall of the chest. And then
How long do you check?
I check for a total of no longer than 10 seconds.
That's right, 5 to 10 seconds. All right, then you're gonna move the clothes away. So let's back up, do that one more time, and we're gonna go straight through it. All right, 1, 2, 3, man down, go.
I'm
Okay,
gonna say, are you okay? Are you okay? Quick, call 911. Go get the AED.
good.
After that, I assess the carotid on the same side that I'm located on.
Excellent.
And I'm looking at the chest. I see no rise and fall of the chest. And
Okay.
then I remove the clothing. And this takes no longer than 5 to 10 seconds.
Good. And now,
Oh,
excellent. Hand in place, do CPR. All right, put his clothes back down. Back up, let's see what they're gonna do with the video. You still gonna have to be up though. You ready?
yes, sir.
Stand back from your man. Let's go. Scene safety and assessment. Steps we just practiced. Ready?
Right.
Let's go.
Okay, let's begin.
You gotta do what
In
they
3, 2, 1.
Okay?
Hey, are you okay? Are you okay?
Are you okay?
Help, someone help.
You gotta say it too.
Help, someone help. Assess the carotid.
Okay?
And I'm looking at the rise and fall of the chest.
Activate the emergency response and get an AED.
Activate emergency response, get the AED.
You ready?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, we're gonna pause for breath normally. Look at your two lights. Make sure you see, get two lights.
1,
Press
2,
one.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, pause. You ready to go again? Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay. Now we see, actually physically, we see how strenuous it would be to actually do CPR. You can be seated. All right, so now we're gonna go ahead and get your pocket mask. We're gonna go ahead and start with it. You ready?
Yes.
You can sit down.
So now, let's go through the use of pocket masks, and then we'll practice one rescuer skills with compressions and breaths. When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with a pocket mask. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with a pocket mask is invaluable. We'll use a pocket mask for the one rescuer activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the person's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique. Place the mask on the person's face, using the bridge of the nose as a guide for correct positioning. Seal the mask against the face by placing the index finger and thumb of your hand that's closest to the top of the person's head along the edge of the mask. Now, place the thumb of your other hand along the lower edge of the mask.
Right
Then,
there, yeah.
place the fingers of that hand under the bony part of the lower jaw near the chin, taking care to avoid the soft
On the
tissue
side,
under
yeah,
the
yeah.
chin. After that, open the airway by using a
Now
head
open
tilt
it,
chin
and
lift.
Very good.
By lifting the jaw to bring the chin forward, you'll lift the person's tongue away from the back of the throat, relieving a possible airway obstruction. Press the mask down while lifting the jaw to hold the mask tightly against the face,
Good.
and give 2 breaths while watching for slight chest rise. Actually seeing the chest rise with
Go ahead
each
and
breath
give 2 breaths.
is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each, with just
Okay.
enough force to produce visible chest rise. Avoid excessive ventilation and pause about 1 second between each
Try
breath.
it again, let me see.
In this practice session, be sure to hold the mask firmly against the face
Okay,
while lifting
good.
the jaw. Also, watch for the chest to rise as you deliver each breath over
So,
1
first, you know,
second.
you gotta be looking
We'll pause
towards the
here
mannequin.
for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths by using your pocket mask with a one-way valve.
Okay, so
We'll
the mask
practice
is
5
actually
sets
clean,
of 2 breaths along
and
with the
you're
video.
only gonna be the only one using it. So they want you to kind of do the breaths on it if you don't mind. You ready?
Yes, sir.
Okay. Just follow along with them.
Get ready. Begin in 3, 2, 1. Give 2 breaths.
Look at the chest.
Watch for chest rise.
Good. Excellent.
Give 2 breaths.
Good. Excellent. You see that chest rise?
Give 2 breaths.
Good. Excellent. Excellent.
Give 2 breaths.
Good. Good. Very good.
Give 2 breaths.
All right. Good. Okay. Now we're going to one rescue of BLS.
Now let's practice compressions and breaths together by
Yeah,
using your
don't-
pocket
don't-
mask
don't
with a
leave the
one-way
mask on
valve.
if you guys
When
take
switching
video.
between
Put it
giving
to the
compressions and giving breaths, limit the time between compression cycles and breaths to 10 seconds or less. Make sure the chest rises with each breath, but provide ventilation just to the point of the chest rising. We'll start with assessment and then combine compressions
So
and
back up,
breaths.
put the clothes
We'll be
back
doing
down.
3 sets of 30
Remember, you gotta
compressions
say,
with 2
verbally
breaths.
say what they're saying.
We'll
and do
pause
what
here
they're
while you
doing.
get into position with the
Let
mannequins.
me move it down, make sure the film can be in there, that's all I'm doing that for. Okay. Move your mask down so you can have it. You ready? Okay, we're gonna do exactly what they're doing on the video. This is your practice room.
Here we go, in 3, 2, 1.
Sing and say.
Hey, are you
Are you
okay?
okay?
Are you okay?
Yep.
Help, someone help.
Someone help. Call 911. Check the AD. Get the AD.
Okay. Good.
Activate the emergency response and get an
Emergency
AED.
response. Get an AED.
1,
Keep up
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, breath. Tilt, one breath. Another breath. Back to chest.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, give 2 breaths. Remember, move your mask off. Okay, get back to compressions. 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, breath. Tilt, breathe. Alright. Back to compression. Good. Excellent, you feel good with that?
Yes, sir.
All right. Bagmans.
When participating in a resuscitation event with rescuers from multiple agencies, the real challenge becomes about logistics. In other words, the coordination of rescuers and resources when more people are
I'm gonna
involved.
demonstrate to you how to
However,
use
your
the
first few
bagman.
steps are the same.
When you arrive, quickly assess the scene and try to get a response from the victim. If there is no response, call for help or activate the emergency response system. Then take 5, but no more than 10 seconds to check for breathing, looking for signs that the person is not breathing or is only gasping, and at the same time, attempt to find a pulse.
Move the victim to a firm, flat surface and begin CPR. One rescuer should start compressions while the second delivers ventilation. After each set of 30 compressions, the ventilator should deliver 2 breaths. A third rescuer should turn on the AED and attach the pads to the victim's bare chest. It's important to know your AED or defibrillator because models can differ. Follow your device's prompts for the next steps.
When the AED signals that it's ready to analyze and that all rescuers must stay clear of the patient, the compressor should switch roles with another rescuer. While the AED is charging, the compressor should take advantage of that time to deliver a few more crucial compressions.
The emergency responder operating the AED is responsible for ensuring that all rescuers are clear from touching the patient to allow for rhythm analysis and before delivering a shock. If a shock is advised, clear everyone and deliver the shock.
As soon as a shock is delivered, rescuers should begin another set of compressions, with a different rescuer delivering compressions, and with a feedback device now in place. Continue these steps until advanced help arrives.
Now let's focus on using an AED. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED, open the carrying case or the top of the unit and immediately power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's bare chest. Use the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the person's age, use the adult pads. On some AEDs, you may need to plug in the pads if they aren't already connected.
After you open the device and power on the unit, follow the prompts and place the adhesive pads on the person's bare chest per the pictures on the pads. Place one pad to the side of the left nipple and the other on the upper right chest, directly below the collarbone. After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the heart's rhythm, followed by a prompt to clear the victim. Strongly repeat the command to clear, checking visually to be sure that all rescuers and bystanders receive the command and follow it. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. You'll repeat the command to those nearby. Loudly state something like, "Everybody clear," and visually check to make sure that nobody is touching the victim, not even the person in charge of giving breaths. Then, the shock can be delivered.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED pads or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the AED's voice prompts. If at any time the AED indicates that no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the area if a razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, Rip the pads off forcefully, removing the chest hair. Then apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If a victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
Okay. So,
Providing effective ventilation is critical to successful high-quality CPR, especially in
so with your AED, you're using the AED the same one that we're gonna be using, they use at the schools? Somebody lost my passport of it, my sticky things, but anyway. There are some differences between the AED use with lay personnel and healthcare providers.
Yes, sir.
With lay personnel, when the AED comes, they stop compressions. And you know, everything stops and we put on the AED. With you, as a healthcare provider, you're gonna continue compressions when the AED come back. The person is gonna work around you as you do compressions. You're gonna look at the pictures. This one say up on the shoulder, put it up on the shoulder. This one say to the side, put it to the side. And then, but the key thing, before you even do any of that, I'm going ahead of myself. Before you do any of that, when it comes back, what's the most important step of operating the AED?
To make sure that the scene is secure.
AED.
Oh,
What's the most important step?
turning it on.
That's it, turn it on. Once you turn on the AED, then all you gotta do is listen. Turn it on.
Apply pads to
It told you to apply pads. There go the pictures where you peg them. You apply them, we ain't gonna do it right now. And then it say plug in to flash, by the flashing light. Then you gonna plug it in,
Analyzing
then it's
heart
gonna say
rate.
analyzing.
Do not touch the patient.
Every time they say do not touch the patient, you should say,
All clear?
that's right, all clear, do not
Shock
touch.
advised. Charging. Stay clear of patient.
All clear?
Good.
Deliver shock now.
And then you deliver
Press
the shock.
Orange button now.
Once you deliver the shock,
Delivered.
then listen.
Begin CPR.
You go back to CPR. All right, then you've checked off on that skill. And we're gonna do it in a little while here, but I wanna see you actually do that right now. So, let's go. All right, you go ahead and move the shirt, and you're in the middle of compression, remember?
Yes, sir.
So you're gonna be in the middle of compression. I'm gonna say, no. Yeah, you're in the middle of compression, go ahead. All right, I'm back with the AED. Now what you gonna do? I'm gonna go ahead and start with the compression, because you've been doing it. And now you gotta do what? What I say, I ain't gonna stop compression.
I'm going to work
6,
around.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Remember, when you turn it on, you gotta listen to it. It didn't say plug it in first. You gotta go in the steps
Apply
to then go
pads.
in.
Plug in
It
connector.
said apply pads.
Then what?
Plug in connect.
Yeah. So that's how you have to do it. That's why when you turn it on, you gotta listen to it. Because if you don't listen to it, you're gonna go ahead of the steps and it'll mess up the rhythm. You ready? Go ahead like you're doing compression. Okay, I'm back with the AED. Now you're gonna go ahead and do your AED. Go ahead. 6, 7, 8, 9, 10, 11, good. 12, 13, 14, 15, 16,
Apply
17,
pads to patient's
19,
rear
20,
chest.
1,
Plug in
2,
pads
3,
connector
4,
next to flashing
5,
light.
6, 7, 8, 9, 10, 1, 2, 3. Gonna go
Apply
breath.
pads.
Breathe,
Plug
breathe.
in connector.
Go back. 1, 2, 3, 4, 5, 6, 7, 8, 9,
Analyzing heart
11,
rhythm.
12, 13, 14, 15,
Do not
16,
touch the
17.
patient.
What you gonna
Do
tell me?
not touch the patient.
So then you're supposed to stop me, so you're supposed to clear me.
Shock
clear.
advised.
All clear?
Not yet. It said
Charge.
advise. It said
Says
advise.
shock advised.
Uh-huh.
Charger.
Stay clear of patient.
All clear?
Okay.
Deliver shock now. Press shock delivered. Begin
So
CPR.
I just finished my round, so you go back to CPR. See how it worked?
Yes, sir.
I'll let you do it one more time. All right. And remember, this is just a practice session. If we get it right here, then we'll get it right when we're doing it with check-off skills. All right, you ready? You doing the CPR, you'll send me for the AED. I'm coming back with the AED. Okay, I'm back with the AED. Go ahead with your skills. I'm gonna take over. 1, 2, 3, 4, 5, 6, 7, 8.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Breathe, breathe.
Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
All clear?
Shock advised. Charging. Stay clear of patient.
All clear?
Good.
Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
Excellent, good job, that's it. All right. So that's what I tell everybody, that AED really make your job easy, because once you get it and turn it on, it's gonna tell you every step, but you gotta go along with the steps in the order that it says it.
Yes, sir.
Yeah. All right, you feel comfortable with that?
Yes, sir.
All right. Let's go on to the airbag.
Respiratory-related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
To begin, position yourself directly above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask
Now
onto
turn
the
his
bridge
head
of the
towards you.
person's nose.
See, like
Then
you got-
lower the mask fully onto
look
the
how he
face,
got his
watching
mask
for the
on.
cushion to bulge as it initially
Tell your man
seals
to get that
against the
same
face.
way.
Form a C with the thumb and index finger of one hand and press down on the dome
You
of the
gonna be at
mask
the head of
toward
it,
the
so it needs
face
to be like
to
this.
further seal the rim of
There
the
you go.
mask. The remaining three
Alright,
fingers
put
of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back,
There you
lift the
go.
jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger
probably
while
have to
lifting
stand
the
right
jaw
behind him
to
because we
achieve
have
an
to pull him back
airtight
to
seal
you.
between the mask and the face.
No, you
And
go like
squeeze the bag
right
with
here.
your other
Pull it back
hand
to you.
or push it against
There
your
you go.
leg or body.
There you
If
go.
the chest doesn't rise with
That's
each
right.
breath, you're not providing
Good,
adequate
good.
breaths.
Try it again.
If you don't get
Excellent,
chest
okay.
rise, readjust
So
the
you feel how to
mask,
do it.
reposition the head and neck, and try again to ventilate. and then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise.
Good.
Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with the bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face,
That's with 2
and the
bags.
3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask.
Yeah.
Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the 1 rescuer bag mask
Just
technique,
1 rescuer
so that in a
this
few
time.
minutes, we can combine
Alright,
it with
so you're gonna
compressions to work on a 2 rescuer sequence.
Okay, you gonna take
We'll
it off?
pause here to get into position.
I'm gonna have him like this, cause this is where he's gonna be at first. And I'm gonna be doing compressions, and you're gonna be ready to give breath. So come up and give breath. You wanna move him like that, put it on, do the tilt, and push him up against you. You can push this up against you too to help breathe. And you go 2 breaths, 2. And then I go ahead and go back to compression, 1, 2, then I do the 30, then you go ahead back to 2 breaths. Excellent. All right, let's go along with the video.
Now that we're ready,
You ready?
let's practice using the bag mask device. Follow along with the video.
You gonna do it like
Here we go in 3, 2, 1.
Just follow his instructions. Do what he doing. Tilt your head back.
Give 2 breaths. Watch for chest rise.
Press down.
Give 2 breaths.
He's not coming up. Let me see. Hold on one second. You take that out.
Give 2 breaths.
Try it again.
Give 2 breaths.
Excellent. Okay, it's coming up now. You do it again.
And give 2 breaths.
Good. Let's do it again, because we got behind on him. Do it again. And you look for the chest to rise. Excellent. Do it again. Okay. So you got the feel of it. You see how? Okay. All right.
Sometimes treatment for a cardiac arrest may be delayed, either because of barriers to accessing the victim or because the arrest was not witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, the 2-person or team rescue is a more common occurrence. So let's first look at the roles for 2-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a 1 rescuer scenario. The second rescuer is responsible for powering up the AED and attaching the pads, as well as providing ventilation when a device becomes available. It's important to remember that the rescuer performing compressions should switch roles about every 2 minutes to avoid fatigue and ensure that compressions remain effective. The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR without an AED, you should switch roles when fatigued or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compressions. We'll learn more about how to effectively switch roles in the team dynamics section.
In two rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be positioned at the person's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Now let's practice 2 rescuer BLS. Follow the video as you practice.
Okay.
We'll work on the full sequence, from the point of finding the victim until advanced medical help arrives.
Okay.
We'll pause here for you to get into position for the 2 rescuer practice.
All right. So it's gonna be 2 rescuers, and you and I gonna be walking together. The person gonna go down, and then you're gonna send me for the AED. Then you're gonna start with the one-man CPR, the normal one-man CPR. Then I'm gonna come back with the AED. We're not using mouth to mouth. We're gonna do the bag mask for the breathing from now on. All right, so let's go along with the video. So let's do exactly what they're doing.
Yes, sir.
Okay, so you come over here.
Okay, let's begin.
You and I-
In 3, 2, 1.
Okay, we walking. You can go back over this side. Oh,
Hey, are you okay?
Are you
Are
okay?
you okay?
Are you okay?
yeah,
Activate the emergency response
Activate the
and
emergency
get an
response.
AED.
Get an AED.
Okay, I'm going to get it.
Karate.
There's no breathing, no
breathing.
pulse.
No pulse.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, hold it. Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Pause.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay. All right, very good. Here's some special considerations that's coming up you need to know for testing. You really need to know these special considerations.
Because most cardiac arrests happen at home or in a public place and not at work, you may not have access to a barrier device during CPR. This means that you may need to give mouth-to-mouth breaths without a pocket mask or bag mask device. Although we won't practice this, it may be a skill you'll need to use one day. This section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to a victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, that breath contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen.
Let's go through the steps to deliver mouth-to-mouth breaths. Start by holding the person's airway open with a head tilt chin lift. With your hand on the forehead, use your thumb and index finger to pinch the nose closed.
Now, take a regular breath and seal your lips around the person's mouth, creating an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest doesn't rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. If you can't ventilate the person after 2 attempts, check for an airway obstruction, but then promptly return to chest compressions. Make sure you give each breath over 1 second and deliver air just until you make the person's chest rise.
All right.
Today, we've looked mostly at the procedures you should perform when someone does not have a pulse. But you should also know what to do if someone has a pulse but is not breathing effectively. When that happens, rescuers should give breaths without chest compressions. This is known as rescue breathing. For adults, give 1 rescue breath every 6 seconds. Also, give each breath over 1 second and make sure that each breath results in visible chest rise. During rescue breathing, you should also check the person's pulse about every 2 minutes.
All right, they want you to practice along with that, watching. So, this is just for rescue breathing. You ready?
Get ready. Begin in 3, 2, 1.
Bag man. Bag man.
Give 1 breath.
Looking back, give him a breath.
Give 1 breath.
Make sure you press it down, man.
Give 1 breath.
There you go, good.
Give 1 breath.
So you give it every what?
2 seconds.
6.
Give 1 breath.
Every
Give breath.
6 seconds.
Uh-huh. Give breath.
Give 1 breath.
Wait, was it 1 breath?
Give 1 breath.
Uh-huh, 1 breath
What
every
is it
6.
every 2 minutes?
Every 10 seconds, that's the lapse in
Give
between
1 breath.
compressions and ventilation.
No, they said 2 minutes or something.
Give 1 breath.
Oh,
Give 1 breath.
make sure you're looking at the chest. Go ahead, because you missed a few of them. There you go. Okay. All right. Now, this is advanced airway. We don't do this one, but you got to know it and watch it.
Another way to deliver
Well, you do it
breaths
in the
is with an
hospital, but
advanced
we
I've done this
airway.
before.
Yeah.
Devices such as laryngeal mask airways, supraglottic airway devices, and endotracheal tubes are types of advanced airways that are more secure for providing breaths. These devices help prevent gastric inflation and airway obstruction. Placing these devices requires special training that we won't cover in this course, but you should know how to give breaths when an advanced airway is in place. When you provide CPR to someone with an advanced airway, the ratio of compressions to breaths changes. Instead of providing 30 compressions in 2 breaths, you'll perform continual compressions at a rate of 100 to 120 per minute, while another rescuer gives rescue breaths. In other words, when an advanced airway is in place, you won't pause compressions to give breaths. This goes for victims of all ages, and not pausing compressions allows blood flow to the heart and brain to remain high.
An opioid-associated life-threatening emergency is one condition that might weaken or stop a person's breathing while they still have a pulse. Opioids are medications used primarily for pain relief. In high doses, these medications can cause a person to stop breathing or can even cause death. Naloxone is a medication that can reverse the effects of opioids and may restore normal breathing. Common ways to give naloxone are intravenous, intramuscular, and intranasal. If you suspect an opioid-associated life-threatening emergency in an adult who is unresponsive and isn't breathing normally but has a pulse, you should give 1 rescue breath every 6 seconds. Then, if your local protocol allows, give naloxone, but do not delay breaths to give naloxone. If the person does not have a pulse, you may give naloxone after starting CPR, but do not delay compressions. For further information on opioid-associated life-threatening emergencies, please consult your provider manual.
Treating cardiac arrest in someone who's pregnant can come with heightened anxiety because 2 lives are at stake. In addition, some rescuers may be unfamiliar with handling the visible anatomy of a pregnant woman. The best outcome for both the mother and the baby depends on BLS rescuers summoning help, providing high-quality CPR, and using an AED without delay. Compressions, ventilation, and AED use are mostly unchanged. If the abdomen is visibly rounded and additional help is available, rescuers should manually displace the rounded abdomen to the mother's left side during compressions to help with blood flow to the heart. More information is available in your provider manual.
Now, that's something that's new too, they're telling us about.
The pregnant woman?
Yeah, moving the, you know, the visible, hump to the left side. That's something new I hadn't heard. It's good to know. Have y'all heard that already?
What you are about to see will include the portrayal of advanced life support skills. As a BLS provider, you may be on a team with advanced life support providers, but rest assured,
Like
those
for
skills are
teamwork.
not part of this training. However, no matter the skill, procedure, or equipment used in a resuscitation event, BLS must continue.
Successful teams not only have medical expertise and mastery of resuscitation skills, but they also practice good communication skills and adhere to the key elements of effective team dynamics. Team dynamics is an element of high-performance teams and can be broken down into 3 categories: roles and responsibilities, what to communicate, and how to communicate.
Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know their roles and responsibilities during a resuscitation attempt, the team functions smoothly.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough rescuers are present, each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 cycles of CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation.
The team member operating the AED or the monitor defibrillator can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the skills of the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occur, including frequency and duration of interruptions and chest compressions, time of shock delivery, and medication administration. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one of them also covering monitor defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, airway, and monitor defibrillator.
Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
I'm getting pretty tired during these compressions. I'm gonna need some help after this.
Sometimes a team member or the team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake.
The next category is what to communicate. Knowledge sharing and summarizing information are critical components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members.
That's our second shock. We have 1 milligram of epi on board.
Okay, starting another 2 minutes.
How about a lidocaine?
Okay, 100 milligrams of lidocaine.
The last category is how to communicate. Closed loop communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed.
This is our first round of CPR. We have 1 shock on board.
The 1 shock on board.
In addition to using closed loop communication, Teams should use clear messaging to help prevent misunderstandings. Teams that work together frequently can create terms or phrases that have specific meaning for them to ensure clarity among members.
So when I'm ready to intubate, what I want you to do is pull that mask off, but keep it handy in case I happen to miss.
Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful and emotions can run high. Understand that this is the nature of CPR and remain focused on the life you're trying to save.
A high-performing team achieves specific performance metrics, including a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest resuscitation attempt. You can only achieve a high CCF by eliminating pauses during high-quality CPR.
The Resuscitation Outcomes Consortium trials, or ROC trials, showed that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest and be prepared to resume compressions.
As a BLS provider, you may notice that advanced providers check for a pulse, pre-charge the defibrillator, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle.
Minute 45.
When using an AED, the prompts will instruct you when to pause. For example, during rhythm analysis or shock delivery.
Switch compressors with the second compressor coming in from behind the first. This allows the second compressor to have the same view of the team, and in particular of the AED or defibrillator. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible, such as while delivering breaths.
Stop CPR, switch. Stay hovering. Shocking, everybody clear. Shock, go.
It's a best practice to use real-time feedback devices during CPR. However, if a feedback device isn't available, a metronome can help establish the proper rate. If your AED or defibrillator doesn't have a metronome, you can download a metronome app to your mobile device before the conclusion of this course.
Nice, no?
It's not enough to know what to do or even how to do it. To obtain the best results, your team must perform both the what and the how flawlessly. That requires practice, and effective practice requires measurement. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Again, you cannot improve what you do not measure. For more information on how your team can implement this type of program, talk to your instructor.
You need to talk to me.
Try and find a metronome.
Okay. Y'all need to see it in your thing. You'll have Siri look for the metronome
Okay.
for CPR.
Okay.
So, instruction for high performance teams, that's optional. You won't go there. You have any questions about anything we went over? You feel comfortable with the skills you've already practiced?
Yes,
You
sir.
good? Okay. Let's go to child CPR. I got your child out already.
Thank you.
Now that we've covered adult BLS, let's discuss BLS for children. It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens. Pediatric cardiac arrest isn't as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related. But in children and infants, cardiac arrest is often due to respiratory problems, such as airway obstruction, drowning, opioid overdose, or seizures.
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters. And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system.
As for a
If
child,
the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio.
okay.
One person will provide compressions while the other delivers breaths through a bag mask device. We'll pause here while everyone gets into position.
Okay. All right, so we're gonna do 2 rescue on the child. Let me get the child, mask, smaller mask. Alrighty. Alright, smaller man, alright, you ready? So we're gonna go from the same skills we did with the BLS with the adult. See how they guys doing. 2 people.
So
Alright,
let's
so you
count
with me?
down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen. Let's go in 3, 2, 1.
Alright, assess the scene. Okay, move
Hey,
forward.
are you okay? Are you okay? activate the emergency response, and get an AED.
Okay. Go ahead and check pulse and look for breathing.
There's no breathing, no pulse.
No pulse.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
15.
1, 2. Okay, go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay. Okay, go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay, hold on. Okay, all right. Feel comfortable with that?
Yes, sir. So it's 15 to 2 for 2
15
minutes
to 2, only for child.
for child.
Yeah, only
15
for
to 2
child.
for 2 minutes.
15 to 2, and then, 2-man rescue, we'll go to the infant, it's the same thing there, but we'll talk about that when we get there.
Okay.
Any questions on any of this? Everything's flowing pretty good?
Yes, sir.
Okay.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can feel completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we use for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device. Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and isn't breathing or is only gasping, send someone to activate the emergency response system and get an AED. If you're alone and don't have a mobile phone, take the infant with you to phone emergency services. Or, if necessary, leave the infant and find a phone. But if no one witnessed the infant's collapse and there's no response or breathing, check for a brachial pulse immediately. If you do not detect a pulse, perform 2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
If an infant has an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds, which is about 20 to 30 breaths per minute. To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm between the elbow and shoulder. Then press your index and middle fingers gently against the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, there are 2 options for hand and finger placement when performing compressions on an infant. The first technique is to place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest just below the nipple line, but be careful not to press on the bottom of the breastbone.
The other is the 2-thumb encircling hands technique. Place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. In very small infants, your thumbs may overlap. Don't apply any pressure on the tip of the breastbone. Now, encircle the infant's chest and support the back with the fingers of both of your hands. In this position, both thumbs will be used to depress the breastbone.
Whether using the 2-finger or 2-thumb encircling hands technique, once in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be at least 100 to 120 compressions per minute. After each compression, allow the chest to recoil completely.
As we get ready to practice infant chest compressions, remember these key
Remember,
points.
it's gonna be 15 to 2.
Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. Allow the chest to completely recoil after each compression, and count out loud as you deliver 30 compressions. So, let's get into position to practice compressions.
All right, now, turn the baby on. He turns on right here. All right, and we're gonna be looking for 2 green lights there. And now, remember, it's 15-2, but now if you by yourself, what was the ratio?
Not by myself, it's 30.
30-2 still. And you don't use the hand encircling procedure. You use 2 fingers and you press in the center of the chest. And you're trying to get 2 green lights like that. See that?
Yes, sir.
That's with one person. And when the second person comes up, and the second person gonna say, yeah, you do that. The second person gonna say, I know CPR, let me help. And then we'll take the baby like this, turn him 1, 2, 3, 4 to the 15. All right? And there go your airway right there for the breathing. All right? So let's go along with the video. See how they got it.
Let's go in 3,
You
2, 1.
Take clothes off.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Okay, they're not, you gotta take the clothes off. They don't have clothes.
Oh.
I had put some clothes on, so. If in real life, you would take the clothes off. The child would take the clothes off. Since they ain't got it with the clothes on, we're gonna go along with that.
Yes, sir.
All right, so hold on a second. So stand right there, and let's start it again. You ready?
Great.
14.
Okay,
Let's go in 3, 2, 1.
all right, 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
What you gonna do? This is just compression right now. 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay? No, we would give breath, but we're not doing it yet. Go. 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Good. All right, you did good. Now we're gonna go to the bag mask.
Now, let's look at the technique for delivering infant breaths with the bag mask device. This is similar to the adult bag mask technique we practiced earlier. 2 things to note before you start. 1, make sure you have the right size mask so that it isn't too big or too small. And 2, remember that chest rise is the most observable sign to determine the effectiveness of your rescue breaths.
First, position yourself directly above the infant's head. You'll use the EC clamp technique that you learned earlier. But be aware that if you tilt or extend an infant's head beyond the neutral position, the infant's airway may become blocked.
Ensure a tight seal between the mask and the infant's face, and squeeze the bag with your other hand to deliver just enough breath over 1 second to make the chest rise. If the chest does not rise, then you're not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air.
Now, let's practice 5 sets of 2 breaths. Deliver each breath over 1 second.
So just go
Deliver
along with
just
him.
enough breath to make the chest rise,
Watch
and make
for-
sure you
once
have
you
a
start
tight enough
rising,
seal with the
stop.
mask on the infant's face. We'll pause here while everyone gets into position.
You ready? So as soon as you see the chest start to rise, stop. We don't want to overinflate on the infant. Okay? We're gonna go exactly with him.
Follow along with the video. Here we go in 3, 2, 1.
Okay. Tilt your head.
Give 2 breaths.
Get 2 breaths. Another, you seal it good.
Give 2 breaths.
2 more breaths. Good. See your chest coming up? Good. Give 2 more.
Give 2 breaths.
Good. Good. 2 breaths.
Give 2 breaths.
Remember, we're going 5 to 10 seconds in between breaths. 6 seconds.
And give 2 breaths.
Go. Good. All right, feel comfortable with that?
Yes, sir.
Any questions on it?
No, sir.
All right, we're getting ready to do the 2-man just like we did with the infant and the adult. We're going to do that with the child.
Now it's time to practice 2 rescuer infant CPR. But before we begin, let's note a couple of differences between 1 rescuer and 2 rescuer infant CPR. One difference is the hand and finger placement for giving compressions. In 2 rescuer CPR, the person doing compressions should always use the 2-thumb encircling hands technique.
The other key difference between 1 rescuer and 2 rescuer infant CPR is the compression to ventilation ratio. As mentioned before, instead of a 30-to-2 ratio in a 1 rescuer situation, 2 rescuers should use the ratio of 15 compressions to 2 breaths. So let's practice compressions for 2 rescuer CPR. As a reminder, make sure your rate is between 100 to 120 compressions per minute. Use the 15-to-2 compression to ventilation ratio because you have 2 rescuers. Make the compressions approximately 1.5 inches or 4 centimeters deep. Allow the chest to fully recoil after each compression and count out loud for your partner.
Time to practice 2 rescuer infant CPR, starting with scene assessment. We will pause here while you get into position with the mannequins.
Okay, another thing I wanted to show you as well. Always remember that checking for the baby, the infant, is different from checking for responsiveness with the adult and child. So when we get ready to check for infants response, what do you tap? This is where you tap. Most sensitive part on the baby, the bottom of the feet. So you tap on the baby, are you okay? Baby, are you okay? On the bottom of the feet. Now, once you tap on the bottom of the feet and he doesn't respond, you got to check for the pulse. Now, where do you check for the pulse on a child?
Right here.
Yeah, let me see. Excellent. So here I am. I'm gonna go through it. They're gonna tell me, baby's not breathing. I'm gonna say, baby, are you okay? I'm checking about. He's not okay. So just like with an adult and a child, I'm gonna tell somebody. I'm gonna say, help. Once I say help, and the person come, I'm gonna tell them, call 911. And then I'm gonna come to the baby and I'm gonna check the pulse on the side nearest me. Brachial pulse. No brachial pulse. Now, if I'm by myself, then I go to doing it like this. Remember? 2, 3. Well, when I come up and I say I know CPR, can I help? Then I take the baby, turn him around like this, and
15.
make sense?
Yes, sir.
Go 15 2. Okay, so let's go with them. You ready?
Yes, sir.
Here we go,
Okay,
in
we
3,
go.
2, 1.
Baby down, you go.
Hey, are you okay? Are you okay?
You look for breathing.
Activate the emergency response and get an AED. There is no breathing and no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay, 2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay. All right, good. Any questions on that? That makes sense?
Yes, sir.
And it's gonna be an AED for infant and children less than 8 years of age.
There are some differences when you're using an AED for infants and children younger than 8 years old. Some AEDs can deliver either an adult shock dose or a child dose for children younger than 8 years old. A pediatric capable AED will have features that allow a child appropriate shock, but the available features depend on the type of AED you're using.
Your AED may also include smaller sized pads that are designed for children younger than 8 years of age. If it does, use them. If not, use the adult pads, but make sure that they do not touch or overlap. But never use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and likely won't be successful. It's better to provide high quality CPR than attempt to shock an adult with child pads. Some AED pads recommend placing one pad on the chest and one pad on the back for infants and children. Follow the pictures on the pad packages for proper placement.
If an infant needs defibrillation, a manual defibrillator is preferred. But as we mentioned before, this device is quite different from an AED and it requires special training that is not included in this course. If a manual defibrillator is not available, an AED with a pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
All right, so here's the one for the baby with the baby pads on top. So, all right, let's try that with this. We're going through the steps. You're gonna be doing the one-man CPR on the infant. Just be doing with the fingers, and I'm gonna come up. Go ahead. Count out loud.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Get your airway, give 2 breaths. Okay? Good. All right, I know CPR, can I help? I'm gonna take 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 2 breaths. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. They're back with the AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What's the first step? First step, there you go. You gotta hold it for a second. 13, 14, 15. Give 2 breaths.
Apply pads to patient's bare
Right, where follow the
chest.
direction.
Plug in pads
1, 2,
connector
3,
next to
4,
flashing
5,
light.
6, 7, 8, 9, 10.
Take this off.
There you go. You can take it off. Take this. Yeah.
Apply pads, plug in
One there.
connector.
One there. Now,
Apply pads, plug in connector. Analyzing heart rhythm. Do not touch the patient.
Operator.
good.
Shock advised.
Operator.
Charging. Stay clear of patient.
Operator.
Okay.
Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, then remember you would just do that until EMTs come, somebody more advanced and take over.
Yes, sir.
Does that make sense?
It does.
All right. Good. Put this back together.
For the clear.
Okay. As you was talking about that block clear, I was gonna say,
No,
what you
sir.
about to do? Alright. Can't talk like one of the video. You ready?
Yes, sir.
When food or other items block a person's airway, choking occurs. In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak or breathe, or cyanosis, that is, turning blue. Adults or older children who are choking may clutch their neck with both hands, making the universal choking sign. If someone indicates that they are choking and cannot talk, you must act. For someone who is standing, you'll perform an abdominal thrust.
To perform an abdominal thrust, stand or kneel behind the person and place your arms around the waist. With one hand, locate the navel. Then make a fist with your other hand and place the thumb side of your fist against the person's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the abdomen with a quick, forceful upward thrust. Repeat thrust until the object is expelled from the airway or the person becomes unresponsive.
If you can't wrap your arms around the waist because the person is pregnant or overweight, or simply can't stand, wrap your arms around their chest and give chest thrusts instead of abdominal thrusts.
If you're not able to relieve choking in an adult or child, or if the person becomes unresponsive, have someone activate the emergency response system. Then lower the person to the ground and begin CPR.
Perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep because this may cause the object to become lodged
Remember that.
farther back
Never
in
do
the
a
airway.
blind finger sweep.
Choking is also a fairly common emergency in infants. The steps to relieve choking in an infant are quite different from those for older children and adults. If you find an infant who is choking but is still responsive, first sit or kneel with the infant in your lap. Hold the infant face down and resting on your forearm with the head slightly lower than the chest. Support the head and jaw with your hand. Avoid compressing the soft tissue of the infant's throat.
Then rest your forearm on your thigh to
actually
provide
slap.
support. With the heel of
There
your
you go.
other hand, deliver up to
Now look at
5
me.
forceful back slaps
Do
between the
like
infant's
that.
shoulder blades. Deliver
you go,
each
there you
slap
go.
with sufficient force to attempt to dislodge the foreign body. Then place your free
Now,
hand
flip
on the
'em over.
infant's back,
There you go, flip 'em
supporting the
over.
head with the palm of your hand. This will cradle the infant between your two forearms
go,
as
flip
you
'em over.
turn the infant
Now do
over
the
while carefully
chest thrust.
supporting the head and neck.
Do the chest
Keep
compression.
the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts in the same location where you would perform compressions, just below the nipple line, over the lower half of the
Right.
breastbone.
Now
Do
flip it
this
back
at the
over.
rate of about 1 per second.
Five.
Repeat the sequence of 5 back slaps and 5 chest
Yeah.
thrusts until the object is
One.
removed or until the
And
infant
remember they
becomes
said you can see
unresponsive.
it, take it out, but never do what?
A blind figure sweep.
Right, never do a blind finger. Okay? You gonna do this along with the video? So make sure you keep the child's head tilted downward. Each time on the back flaps, it should be tilted. And even on the thrust, it still should be tilted. Compressions, I'm sorry.
Now that you're in position, let's begin. Follow along with the video as you practice. Here we go in 3, 2, 1.
1, 2, 3, 4, 5.
Tilting down now.
1, 2, 3, 4, 5.
Okay, flip them back over. Tap. hit,
1, 2, 3,
In the center
4,
of the back.
5.
Press.
1, 2, 3, 4, 5.
Okay, flip them back over.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Okay. Comfortable with that? You need to do it again. Comfortable with it? Okay.
As with an adult, if a choking infant becomes unresponsive, shout for help and have someone activate the emergency response system. Then, lay the infant face up on a hard, flat surface. You'll perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the object.
To give breaths for an infant, the mouth-to-mouth and nose technique is preferred. For this technique, you will first open the infant's airway with a head tilt chin lift. Then, place your mouth over the infant's mouth and nose to create an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift to reopen the airway and try to give a breath that makes the chest rise. If you cannot cover the infant's mouth and nose with your mouth, use the mouth-to-mouth technique instead. The mouth-to-mouth technique for an infant is the same as for an adult.
If you can see the object, carefully try to remove it. Never perform a blind finger sweep. You should only try to remove an object if you can see it. If you're alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system. We'll pause here while you get into position to practice with the infant mannequins.
Okay, you ready? So what we getting ready to do, they're gonna be choking first, and then after we try 5 sets of the slaps and the compressions, they're gonna go out. And when they go out, you put them on a hard surface and start what?
Providing rescue first.
You provide CPR.
CPR.
Okay, all right. So let's go ahead with, you can sit down, and you're gonna go ahead and start with the choking first. Then I'll tell you when they're out. Okay? You ready? 1, 2, 3, go.
1, 2, 3, 4, 5.
Flip,
1, 2, 3, 4, 5.
flip,
1, 2, 3, 4, 5.
flip.
1, 2, 3, 4,
Now
5.
he's went out. So put him on a flat surface. And what are you gonna start with? Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
You won. You by yourself, number 1.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You're getting breath with the bag
Tilt,
match.
chin lift.
Go ahead and get with the bag match.
Oh, okay.
5, 10 seconds. Okay, now back to compression.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Give him 2 breaths. I know CPR. Can I help? Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then somebody comes back with the AED. We put the pad on the front, put the pad on the back. And we turn it on, put the pad on the front, pad on the back. Let it analyze, clear. We all clear. And then when this is analyzed, it said push for shock. Go ahead and push for shock. And then when we listen to it, and if it say continue CPR, we go back to CPR, and we do that until the EMTs come or somebody more advanced than ourselves. Does that make sense?
Yes, sir.
All right, let me take the baby, clean him up, and we'll continue on.
We covered a lot today. You learned the proper BLS rescue techniques of CPR and the use of an AED for all age groups, the importance of effective teamwork, as well as how to perform in a 1 rescuer or 2 rescuer scenario. You've also learned rescue breathing and what to do for someone who is choking.
Thank you very much for your time and attention today, and especially for your commitment to learning these critical life-saving techniques. We appreciate and honor the important work you all do as healthcare professionals.
Alright, so just in review, remember the Ross, you return of spontaneous circulation. We gotta make sure after, this is for an adult, we gotta make sure after that Ross returns, we still gotta watch him. And then sometimes basically because of opioids, nowadays, the opioid overdose now, you may not have to do what? They may have a pulse, so you may not have to do what? That's right, you may not have to, so it's called rescue breaths. You do the breaths only.
Right.
And you do them every what?
For the adults,
Yeah,
you do, every.
it's the same as adult,
Six.
child, 6 seconds, that's right. And we wanna, watch for the visible rise and fall of the chest and just keep doing it, until once again, if they stop, when you check the pulse, if it's gone, then you go to CPR, go into CPR mode. Remember with the child and the infant, the ratio is the only thing that changed. With the child, the ratio changed to what? Compressions to breath,
It's,
with 2 people.
oh, it's 2 people, it's 15 and 2, so one man is 30 and 2.
Right, 30 to 2 with all of them, if you're by yourself.
Right.
But with child, 15 and 2, infant, 15 and 2. There was a difference in the infants and where you check for pulse. With adult, you check where?
Carotid,
And then with the infant, you check what?
brachial.
Brachial, very good. And so, and then what do we check for responsiveness on the adult?
You tap him on the shoulder.
Right,
The
and infant, child, same thing, infant, what do you do?
The foot.
The foot, because it's the most sensitive part. And remember with giving breaths, the key thing with giving breaths is not to inflation. We don't want to overinflate, because we'll have more air going into the stomach, and we don't want that to happen. That could cause aspiration, like they said. The person could choke, so we don't want that to happen. Or it could cause vomiting, so we don't want that to happen. So do you have any questions about anything? Most of these skills are pretty rudimentary to you because you do them, but we have to keep ourselves abreast with this every 2 years because we're not doing it every day, and so we forget some of the steps. Is there anything you need more practice on before we go on to the testing?
No, sir.
All right, well, this is going to conclude the recording part, and then we're going to do the testing and the skills check off, and then the testing. Thank you for your time.